Today's topic is overcoming obstacles to weight loss. For those of you who haven't heard me speak before, my name is Dr. Lauren Lemieux. I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by my colleague, registered dietitian Casey Curlin, who has over 15 years experience in weight management and loves helping her patients overcome obstacles. Just a few announcements for today. This webinar is being recorded, and after the webinar, you will receive a link to the webinar recording, as well as more information about how to contact us and possibly to sign up as well. So for you to get the most out of today's talk, I really want you to reflect on your own life, your own experience with trying to lose weight. There must have been some reason why you saw the title of this talk and joined us today. So chances are you've been thinking about your own obstacles. We'd also love for you to use the chat feature in Zoom to share your own experiences, challenges, ask questions, and we want to make this as interactive as possible. Now, note the default for your comments is to be seen by everyone. So if you prefer to remain anonymous, you can either change your name and create an alias, or select that your message is only seen by the host and panelists. So when thinking about your obstacles, I think it's a great idea to start reflecting on some of the various factors that contribute to one's weight. Now, this is by no means a complete list, but just some things to get you started thinking about your own situation. Lots of factors that can contribute to our weight, maybe out of our control, and others maybe are things that we're working on. And some challenges may include, for example, our environment, whether or not we have access to healthier foods, whether we're able to get out and do physical activity, what our levels of stress are like, how we're sleeping, or other medical conditions we may have that are making it more difficult to lose weight. So I'd like to start off our discussion looking at nutrition. So again, feel free to share in the chat any obstacles you're facing as it relates to having a healthy nutrition plan. And while you're writing in, Casey, as a registered dietitian, what are some of the common obstacles that patients face as it relates to nutrition?
So a lot of the common obstacles I hear are things like, I don't know how to cook, my meals have to be family friendly, so how am I going to negotiate around that? Things like I crave junk foods, eating healthy is too expensive. But the main thing that I tend to hear the most often is that I don't have time to prepare my own meals. Everybody is super busy. And the main thing that I really try to focus on with my patients is initially finding super quick and easy meals. So not something that's going to be overwhelming for you. We like to focus on planning your meals of increasing protein and vegetables. So, trying to find super quick, easy things for that, like using the frozen section and getting, frozen veggies to do like a quick steamer bag of veggies with your meals, or even going to the already prepared section of the grocery store and getting the already chopped up veggies that you can just quickly add to, a pan to saute or something, or into the oven to roast, quick, easy things that you can just throw together and not have to spend too much time. Other things too are, we really want to make sure you're having adequate protein sources at your meals as well to help keep you full. So looking into those already prepared protein sources, like picking up a roasted chicken at the deli, or looking into already seasoned meats at the butcher counter, or even the frozen chicken or fish steaks, or a low carb veggie burger, are all great options to just keep on hand, like keep your freezer stocked for those quick, easy meals. And, nowadays there's a lot of those really helpful meal delivery services out there. So, they either have the meal kits that they send you everything and you prepare it yourself, or they have the ready-made meals that you just, keep in your fridge and throw in the microwave. And that's just something quick and easy for a lunch or a dinner. But, another thing too that really helps to get over a lot of these different obstacles is really sitting down and planning out your meals for the week. And what I mean by planning is not necessarily spending, 3 hours on Sunday prepping everything. It's more just taking time to sit down either by yourself or with your family and planning out what you're going to have for lunch and dinner so you can make your shopping list and then plan in a little bit of time to either go to the store or actually just go onto an app and put in all your food into your shopping cart and have it either delivered to your house or just swing by and pick it up after work for something quick and easy. Because the more you are planned for the week and you plan in for those, crazy busy nights that you have a million things going on, the easier it is for you to stay on track and you're not, standing there at the fridge at 5:30 trying to decide what you want to have and then give up and order takeout. So
Absolutely.
it definitely helps you to stay on track.
Yeah,
Um,
having that backup is really helpful. And I think, like you pointed out, you don't necessarily have to be the one who's cooking and preparing everything. Maybe it's that you've grabbed that rotisserie chicken and you have it available so that you don't have to spend, a half hour roasting a chicken and doing all
exactly.
that work. One of the strategies that a lot of my patients like is, pre-made protein shakes. I mean, they're super
Mhm.
simple. You have them in the fridge and they're ready to go. So when lunchtime rolls around and you're like, oh, shoot, I forgot to pack my lunch, or I don't know what I want to do, and you're looking, at your phone trying to order takeout, having that, giving your body a moment to get a little bit fuller before making the decision of what you're going to eat can really help. And it looks like someone wrote in here that one of the challenges that they face is related to essentially feeling like they have to cut things out or feeling like they can't have certain things. And I'll tell you, I've had patients who come to me and talk about going on a keto diet or ketogenic diet, which basically is an extremely restrictive diet. You're dropping your carbohydrate intake down to, at times less than 50 grams a day to achieve ketosis. And they find that, okay, they're able to stick with it for a week, 2 weeks, but as time goes on, all they can think about is, having some bread or having a piece of fruit. I mean, it's really restrictive. So, Casey, when you have patients talking about these like restrictive eating plans, is there any advice that you give them?
Yeah, I really try and get people out of that habit of classifying foods as good versus bad and, completely eliminating things because, yeah, you're eventually going to, what I find often is, all you want is a sandwich. So you end up eating everything else in the pantry trying to satisfy that sandwich craving or whatever the craving is. Whereas if you just gone ahead and had a sandwich, then you probably would have been completely fine. Now, maybe you could do things like, look for a lower carb bread or a higher fiber bread to make that sandwich with, so there could be some potentially different options that we could face, to kind of make them a little bit lower carb in general, but still, having the things that you like just within reason throughout the week. And I oftentimes too have patients who like maybe there's like a family pizza night or something like that. And they're like, well, what am I going to do on pizza night? And I'm like, enjoy the pizza, but maybe buy a bag of salad that week and on your grocery list so that you can have a little bit of salad with it to kind of fill you up. And then maybe if you are being super mindful of your carbohydrates, maybe do like, a protein shake for lunch and then save those lunch carbs for dinner. So you can definitely negotiate things into your day so you're not having to deprive yourself.
Mhm. Absolutely. And I think it's so important to keep in mind that what studies have shown again and again, that it's not really a specific type of diet that's the best for weight loss long term. What the studies tell us is that what someone can maintain long term, what is sustainable, is what promotes the overall greatest amount of weight loss and arguably most importantly, maintaining the weight that's lost. And we want to avoid this sort of back and forth where we lose and then gain and lose and gain for many reasons. But in part, when we talk about that with patients, we really want to think about, is what you're doing something that's sustainable long term? And actually, I see another comment here, someone who struggles with just balancing food. The person exercises, so not sure, how much protein should I have, carbohydrates, fats, or calories. Casey, is there a particular like strategy you employ for patients who are working out or, giving them a balance in terms of these macronutrients?
Yeah, definitely. So we take everybody into consideration individually. So depending on what you're doing throughout the day, we really make sure that you're trying to focus on a good protein source. Normally, what I recommend for my female patients for protein is about 20 grams at each meal. So, for example, if you wanted to have, like, say, 20 grams at lunch, that would maybe be a chicken breast about the size of a deck of cards. And then for my male patients, I recommend mainly doubling that. So maybe, 2 deck of cards for your protein. So making sure there's a good protein source at every meal, and then really focusing on, ideally half your plate vegetables. And then I kind of like, for an easy guide for your carbohydrates, is if it's more than your fist, we probably should have a little bit less. So it's kind of an easy guide for, distributing those macronutrients throughout the meal.
Yeah. And, for people who've tried to, navigate this sort of balance on your own and are just really struggling, sometimes having the support of, a registered dietitian or your medical team can help provide that sort of guidance that maybe you're not getting when just, plugging in your information into an app and it spits out, oh, this is how many grams of carbohydrates you should have. The other thing that I see with patients, as it relates possibly to this topic, is how do I eat when I'm also working out? And so I think, of course, that has to be taken on an individual basis. When you're working out, what does that actually mean? Are we talking about, very vigorous, intensive exercise for over an hour? Or are we talking about, doing an at-home workout, moderate intensity for half an hour? That more moderate, light activity, that's not going to require additional caloric intake. But I do have patients who tell me that they notice when they're working out, their appetite goes up. Casey, do you have any strategies for that type of situation?
Yeah, I oftentimes see this, especially in my female patients. It's like as soon as they start working out, their appetite goes through the roof. And I definitely recommend, the timing of your meals and the timing of your exercise. So, maybe if you can, doing your workout right before lunch or dinner and then having your meal right after, and then making sure that meal is really protein focused, and then a lot of veggies with fiber, and your carbohydrates high in fiber too, to help keep you full. Or if you can't work it in like that or right around your meal, maybe having a good protein and high fiber carb or vegetable snack right afterwards to kind of fill you up. So really, we work on timing of those meals and your exercise.
Absolutely. And then another person wrote in, I have a medical condition that leads me to have a really increased appetite. How do I navigate that? And there can be a number of different nutritional modifications that we might make, as Casey's described, talking about fiber and protein intake. But also, that may be a situation where medications that help control appetite might be another option to help with that as well. All right. So let's one other question someone has is related to insurance. So does nutrition take insurance like Medicare? That's a great question. So as far as I am aware, unless something has changed, Medicare covers medical nutrition therapy. So typically that's a registered dietitian for very specific medical diagnoses. Those are type 2 diabetes, chronic kidney disease, and someone who's had a recent kidney transplant. Now, I wish that there was a much larger list that was actually covered, and hopefully that will change in the future. But at this time, that's what the Medicare coverage is, at least from the most recent information that I've had. So let's switch gears and talk a little bit about physical activity. So is that a challenge for many of you who are trying to lose weight? And if you want to share any examples or questions, feel free to do so. Okay. And I'll take a moment just to share a story here with a patient that I had recently, where one of the things we were talking about is how he really wanted to be more active, but he just felt like there was just no time in the day. And so we did this experiment. I'm not sure if you've ever done this before, Casey, but I actually did it with him as well, where we wrote down what you do in a day and just take notes as you're going throughout your day. And what this patient found was that he was checking his email something like 15 times a day. And it was either on his phone or on his computer. But what he found is there was a lot of redundancy. He'd check his email on his phone and then say, oh, I can't deal with this now. And then, an hour later, see it on his email and then have to read through it again and go through this whole process. So we strategized, okay, we're going to check emails like 4 times a day and just see if that even works. And what he found is that he was getting more efficient with his work, and he felt comfortable taking a little extra long lunch break, about 20 extra minutes, where he was going for a power walk. And that was a really helpful tool for him to find that extra time in their day. Anyone else who has any comments about exercise or activity and weight loss? And Casey, any experiences that you've had with your patients?
No, I definitely like what you were talking about going through the day with people. It really helps. And I had a person that I worked with years ago that used to have the saying, if it takes 60 seconds or less, just go ahead and do it. So, like doing some of those things that we just kind of like repeatedly do throughout the day, that if we just went ahead and did, like going ahead and just responding to that email really quickly instead of having to read it twice. Or, I say this to myself all the time at night when I'm like, okay, it's just going to take a few minutes. Let me go ahead and make my daughter's lunch for tomorrow, or go ahead and do this for tomorrow. All those things seem like they're going to take a lot of time, but when you actually go ahead and do them, it doesn't take that much time. And even if it's something for physical activity, just like going ahead and putting your clothes out for that next morning, so that you can either go ahead and pop on your clothes and get outside and do a walk, or take it with you to exercise at work. Those little bitty things can really help you to keep motivated and actually complete your goal.
Mm-hmm. Yeah, and I have a lot of patients who find that, by the end of the day, so much is piled on that they had these great intentions and plans of doing, their exercise that they wanted to do, but they're just so exhausted. And so in that situation, sometimes strategizing, all right, we're going to not just wake up a little bit early, but we're actually going to go to bed earlier too. And so it's that extra step of, setting a reminder like, okay, I'm going to start getting ready for bed at 9:30 instead of my usual, 10:30, 11. So I know I can get up earlier and function the next day as well.
Mm-hmm. So Lauren, someone asked, what do you recommend for exercise for someone who is, has a lot of extra weight and maybe has a lot of issues with knees and ankles and different things being painful when they're exercising?
Mm-hmm. So one of the things that I think is really important is to remember that it's your body. We need to be careful, and we also have to work with the resources that we have. And so what that means is, first, think about what can I do that's getting myself moving, that's not causing me extreme pain. If you are having a significant amount of pain, that's an important discussion that you should be having with your doctor too, to see, okay, is there something physically that we need to address, that we need to make sure we diagnose? Do we need a referral to a physical therapist to make sure we're not further promoting any injury or worsening the condition? I will say, though, there are a number of very low intensity exercise resources that are out there, and even exercises that can be done in a chair, simple things like leg lifts, or even everyday movements like getting up from sitting to standing, trying to do that without holding on to the arms of a chair, or just maybe holding on to one and taking it step by step. Physical activity doesn't need to be going out and running for 3 miles. It really is starting with where you are and adjusting it for your lifestyle. The other comment I'll make is, while obviously things like arthritis extremely painful and does limit our mobility, studies have shown when people are able to be more active in that situation, knee pain, for example, can actually improve. So there can be some benefit to getting moving in these types of situations. And then, one other thing I do want to point out is a lot of patients may think that because they can't exercise, I'm never going to lose weight. And what this study looked at is, what do we see in terms of the amount of weight that's lost with let's say just exercise by itself. And they found that on average, weight loss was maybe none, so maintaining weight, or up to about 3%. Meanwhile, if you add exercise with the nutritional component, with a reduced calorie diet, we see about 5 to 15% body weight loss. So if exercise is something that maybe is not possible for you right now, or something that is really challenging to do in addition to the nutritional component, maybe we should really first focus on the nutrition, get that down, and then find ways to incorporate the physical activity once we've built that nutritional foundation. Okay, so let's talk about the dreaded plateau. So a common scenario I see is, patients who've come to me and I've tried to lose weight before, I lose 5 or 10 pounds and it just stops no matter what I do. Casey, is this something that you encounter often?
Yeah, I hear this quite frequently. And, I like to start this conversation with overviewing typical weight loss patterns. So, we all would love to lose weight and just a linear downward line, but we know that's not realistic. And every person loses weight differently and sees a slightly different pattern on the scale. And these patterns consist of different processes of losing, gaining, and then plateauing through the weight loss journey. So some people might see an initial loss and then a plateau and then even a slight gain before they drop down again. And all of this could be over a couple of days or even a couple of weeks. And that's where it gets really frustrating. So, really kind of learning what your weight loss pattern is and being okay with those plateaus or the slight gain here and there. And, keeping in mind, you're not necessarily doing anything wrong. Your body is just readjusting and trying to be okay with getting past, whatever set point it is trying to get you back to, because your body's always trying to regulate you back to whatever its predetermined set point is. So sometimes it takes a while to get past those set points and, get past a plateau. And, just keep reminding yourself that these patterns happen to us all. And normally without the help of a good support system, when we reach a plateau, or we gain, we just stop, give up, and then go back to your, old unhealthy habits. And, keep reminding yourself that you're not likely gaining fat. You're just in the process and your body's readjusting. And this is where that good support system will help keep you motivated to push through these tough times. So remember, this is not a sprint, it's a marathon. So Lauren, and can you go over more into maybe why weight loss can be so challenging?
Absolutely. And I don't know if you guys can see this as well, but our poll shows, 90% of people who responded have experienced a plateau. And this is unfortunately very, very common. One person even mentions this is the point where I give up in our chat. And absolutely, it's frustrating when you feel like you're doing all the right things and you're not seeing the returns that you were getting before. And so it makes you question, why am I doing this? Why am I working so hard at this and not seeing any progress? And there's a number of reasons why that can be the case. This is a picture I love to show because for a lot of people, it feels like this tug of war. You're trying to, cut down on the calories you're eating. You're trying to move more, but it just feels like something's pulling you back in the opposite direction. And what research has shown us is that there are physiologic changes that happen when we're losing weight, which are very frustrating, but they helped our ancestors survive. Unfortunately, they're working against us now. And they are our metabolism slows down and hormones that affect feelings of hunger and fullness change. So they effectively promote weight regain in that situation. Now, these are, of course, are just some of contributing factors and by no means, a comprehensive picture, but it gives the example of why this can be so challenging. And that's where, working with a team can be very helpful to help identify some of those other factors that are slowing down your weight loss progress. I often talk to patients about, let's reflect on what you were doing when things were working and what are you doing now? And is it the same? And then in some instances, when you're working with a medical weight loss program, there may be a discussion about using medications to help overcome some of these biological changes that happen that make it difficult to lose weight, specifically medications that might decrease appetite that can then help you either lose more weight or prevent you from regaining the weight that you already lost. And I think it is just so important to acknowledge that weight loss is difficult. Maintaining weight loss is also extremely difficult. This was a study that looked at what happens to people's weight over the long-term period. And so people lost weight. About 2 years later, 50% on average of the weight that they had lost was regained. Fast forward to 5 years, and that's closer to 80%. And I'm sure many of us have experienced losing weight and then regaining it, and it being just this very frustrating cycle. So that being said, there are specific tools that have been shown to not only help patients lose weight, but to maintain that weight loss long-term. And these are part of our toolbox for overcoming obstacles. Specifically, these are nutrition, physical activity, mindset, behavior shifts as key foundational strategies. And then, if appropriate, we may also consider medication therapy in the context of working in a medical weight loss program. But we also know that having a support system, whether it's working with medical professionals, a coach, friends, or family, that can be extremely beneficial. And so, Casey, why don't you talk a little bit more about the support aspect?
Yeah, so this here shows that various studies have demonstrated that long-term weight loss maintenance is more likely to be successful when patients have support, as shown in this graph here. In this study, the first 4 months, all patients had some form of support visits for weight loss. However, you can see after 5 months that those who had regular maintenance visits with a healthcare provider were able to effectively maintain a good percentage of their weight loss up to a year. Whereas, as you can see here in the blue line, at the 5-month mark, patients without maintenance visits started to regain their weight. So this really shows the importance of a good support system and doing regular follow-ups with your care team to help you to maintain your weight loss. And so, part of this is reflecting back on questions we asked at the beginning of what are your obstacles, and with this in mind, we oftentimes like to come up with a good plan that's a little bit more attainable when we're coming up with plans for these obstacles. So we like to set up what we call a SMART goal to help you overcome some of these obstacles. So what SMART stands for is it's a mnemonic that is specific, measurable, achievable, realistic, and time-bound. And it's something that I like to use often with patients. And so, like in this example, it kind of goes over what a SMART goal might be. So instead of saying something like, I'm just gonna, eat healthier at lunch, maybe adding in more specifics, like instead of packing chips with my sandwich, I'll have apple slices. And then I'm going to log it on my Form Health app, because we have a function on the app where you can take photos of your meals and post it to the app. And then the measurable part would be, I'll do this at least 5 times per week. And then you do want to make sure that the goals are achievable, such as, I like apples and can easily get these from the store. So it's something that you can easily do. It's not like you're saying, I'm going to add asparagus to my lunch every day, and maybe that's not something that you really care for. And making it realistic, improving my eating habits can help with my weight loss goals. So it's something that that's going to be beneficial to you. And then time bound. So setting a time to your goal, like a specific start date, like I'm going to start this on Monday and I'll do this every day of the week. So this is really kind of how we like to plan out some of those goals to make them more achievable.
Great. Yeah, I love using this tool with patients because, like you said, it's not just, I'm going to eat healthier. It's, I'm going to do this specific thing at this time, and really, committing to it too. Once you say it out loud, it's out there, right?
Mm-hmm. Yeah.
All right. So in the last couple minutes, if anyone has any questions, feel free to type them into the chat. I'm just going to briefly go over what our approach here is at Form Health. And, if you're interested in overcoming any of your obstacles, we absolutely would love to work with you on this. So what we do at Form Health is you are paired with an expert physician who's board certified in obesity medicine and an experienced registered dietitian. And together we get to know you. We try to understand what are these obstacles that are getting in your way. And with that information in mind, we come up with your personalized nutrition, physical activity plan. We discuss mindset shifts, behavior changes to help you achieve your goals. Because this is a medical weight loss program, you are working with a physician, and it may be discussed whether medications are an appropriate option for you. But that is under the discretion of the physician who you are working with. Additionally, I want to point out Form Health is entirely done through telehealth or telemedicine. So you get to see your healthcare team from the comfort of your home with just your phone. It's very relaxing in that respect. And as Casey mentioned, we have an app. The app we use to have patients track their weights. They can also take pictures of their food, and that really helps with the accountability portion. And then there's the support aspects. So you have unlimited messaging with your team, and it really provides, as we mentioned, that complete picture of the foundational tools, nutrition, physical activity, mindset shifts, plus the support and accountability that studies have shown do help promote the most successful long-term weight loss and weight maintenance. So if there are any questions we didn't get to, or you want to schedule a call to speak with one of our team members, feel free to check out our website, www.formhealth.co. And we really hope that we will get the opportunity to work with some of you in the future. So thank you all so much for joining us. I don't think I see any new questions here. Let's see. Oh, I think someone was asking about our program. Is there a specific length of time to join? I think if I'm reading the question right, is the program for a specific amount of time, like just 6 months or a year? And the answer is it's not for a limited amount of time. What we know is that weight loss and weight maintenance is challenging. So we're here for you for the long term. This is not a 30-day program and then we'll see you later. We're part of your healthcare team. All right. Oh, and then one other question I see here. Do supplements cause weight gain? Specifically asking about vitamin C, D, E, collagen. So specifically those supplements, from a medical perspective, should not cause weight gain. Whether or not you should be taking them is a completely different discussion. So definitely something to speak with a healthcare provider about, because there may be reasons to take them as well as not to take them. So I think that's it for our questions. Any last minute questions you see, Casey, or anything else you want to add?
Yeah, no, I think that's everything.
All right. Well, thank you all so much for joining us. Again, we really hope we get the opportunity to work with you all in the future, and have a wonderful rest of your day. Take care.